Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Ghazi Abrar. I am a postgraduate resident at the Department of Hepatogastroenterology, SIUT. The topic of my abstract is the diagnostic accuracy of the neutrophil to lymphocyte ratio in predicting non-alcoholic fatty liver disease in Helicobacter pylori positive patients. So, non-alcoholic fatty liver disease is a multifactorial disorder and most frequently associated to obesity, diabetes mellitus, dyslipidemia, and metabolic syndrome. Recently, there has been a special focus on the role of H. pylori in the development of NAFLD, NASH, and liver cirrhosis. The pathogenesis of Helicobacter pylori with NAFLD is not clearly defined, and the relationship between these two has been reported to be variable. The aim of the study was to determine the diagnostic accuracy of the neutrophil to lymphocyte ratio, that is the NLR ratio, in predicting NAFLD in Helicobacter pylori infected patients. So in our study, we took all the patients with H. pylori infection and a fasting percutaneous abdominal ultrasound was performed in all patients to diagnose the fatty liver. NLR ratio was calculated as a non-invasive predictor of NAFLD in H. pylori infection. All the data was entered and analyzed by the SPSS 20. Results were presented as mean and standard deviation for the quantitative data or as number with percentages for the qualitative data. The student t-test was used for the analysis of the continuous variable, while the categorical variable were analyzed using the square test. A p-value of less than 0.05 was taken as statistically significant, and to determine the cutoff point, the ROC was computed for the NLR score and the area under curve was determined. The sensitivity, specificity, positive predictive value, the negative predictive value, and the diagnostic accuracy were obtained for NLR in predicting NAFLD in H. pylori positive patients. A total of 98 patients who were H. pylori positive were included in the study, and at presentation, 63 patients had dyspeptic symptoms for more than 2 months. Comorbidities like diabetes was seen in 14 patients and hypertension was present in 8 patients. 52 patients enrolled in the study were males, while the 46 patients were female. Fatty liver was present in 77.6% of the patients. On non-invasive investigation, the mean TLC was 12.1 with a neutrophil of 58.6 and a mean lymphocyte count of 28.6. The TLC and lymphocyte were lower in the fatty liver group as compared to those without fatty liver, while the neutrophil were higher in those with the fatty. 86% of the patients who had an NLR ratio of more than 1.69 have evidence of fatty liver on the abdominal imaging. The area under the ROC curve for the prediction of non-alcoholic fatty liver disease in H. pylori infected patient for NLR is 0.70 with a p-value of less than 0.0. The sensitivity of NLR for the prediction of fatty liver disease in patients with H. pylori at an NLR cutoff of more than 1.69% have a sensitivity of 83%, specificity of 41%, and a diagnostic accuracy of 73.47%. So in conclusion of our study, the performance of the NLR for the prediction of fatty liver disease in H. pylori infected patients was accurate in 73.5% of the patients. However, further studies are required for the validation of role of NLR in detecting fatty liver disease in H. pylori positive patients.